Hi, this is Craig Heger with Ecofine Properties, the next wave in real estate. Today I'm fortunate enough to be here with Dr. James Starman, a very talented orthopedic surgeon at the Center of Bone and Joint Surgery, currently on site at the Wellington Regional Medical Campus. How did you get into medicine?
So I grew up in Pittsburgh, and when I was first kind of coming up into my teenage years, I had some exposure to veterinary medicine, believe it or not, and had an opportunity to observe some surgeries. Actually saw an orthopedic procedure done on an animal and kind of piqued my interest, and from there was just fortunate to have the right mentors and opportunities along the way, and developed my interest in orthopedics. My fellowship training is in sports medicine, which gives me an opportunity to do a lot of arthroscopy, both of the shoulder and of the knee, and I also do lots of complex reconstruction procedures of those joints. I also have a very general orthopedic sports practice, and I'm involved with shoulder replacement surgery and knee replacement surgery and lots of cartilage restoration and meniscal operations.
Now, I do have to ask, besides myself, you know, the All-American flag football star that I was, have you ever operated on any other, I guess, athletes in our area?
So I have, obviously for privacy purposes, I can't tell you exactly who I've done, but yeah, we take care of pretty much the recreational weekend warriors all the way up to some of the elite level athletes competing at national and international levels. ACL surgery is an area that I've done quite a bit of research in. It's a very active area of research nationally, and so we've learned quite a bit over the years, especially over the last decade with respect to the maturation of the graft tissue and when is it safe for athletes to return to competition, so which is the question that everyone wants the answer to. What we've learned in the past, we used to release most of, if not all of our athletes back at about 6 months after surgery, and unfortunately we learned the hard way that a number of those patients would go on to re-tear their ACL, which most of the time happens in the first year. And so some additional research has been done looking at imaging the graft material itself and seeing how it looks compared to normal ligament. Even if patients are feeling good, it's not necessarily the best idea for them to return to full activities before at least 1 year.
What other offices do you have across the county?
Our practice is a fairly large one. I'm part of the Center for Bone and Joint Surgery, and we have about 14 different orthopedic surgeons on our practice. So we have offices pretty much all across the county. Most northern office would be in Jupiter. We also have an office in Palm Beach Gardens, and where we are today here in Wellington, we have several locations, as well as Royal Palm Beach and all the way down to Boynton Beach.
Dr. Starman, I appreciate you having us today. Unfortunately, I hope I don't have to meet you in the operating room ever again, but it's always a pleasure. You're a true, genuine guy.